In this video, I will discuss about the medial closing wedge distal femoral osteotomy. Hello, I am Dr. Dinesh Thakkar, knee preserving surgeon, practicing at HTO Knee Clinic, Long Life Hospital, Paldi, Ahmedabad. Here is a case of 22-year-old girl has a valgus deformity in her right lower limb. In X-ray, we can see here that the weight bearing axis is passing from the very far away from the middle of the knee joint, and on left side we can observe that weight bearing axis is passing from the medial compartment. So she was worried about this, her cosmetic appearance, and her father was also worried about cosmetic appearance because she was at the age of marriage. So we planned distal femoral osteotomy. Now if we see her full length X-ray and if we do a pre-operative planning, here we can see that there is a valgus angle of 11 degree on right side, and if we may do a malalignment test, in malalignment test medial proximal tibial angle is 88. As we all know that MPTA should be 87 plus or minus 3, so here MPTA is in normal range. And if we measure the lateral distal femoral angle, the normal value is 87 plus or minus 3. Here instead of 87 it is 77, so whole deformity lies in the distal femur. So if we are planning corrective osteotomy, then we should plan in the distal femur, medial close wedge distal femoral osteotomy. Now how we can plan how much wedge has to be removed and from where it has to be removed? So if first of all we should plan how much angle we have to remove from the distal femoral medial closing wedge. Before that, calculating to that, we should first draw a line from center of head to the center of the ankle joint, which represents here as a yellow line, and then a line B is from the center of the ankle joint to the point where we want to bring our weight bearing axis after surgery, and it should be extend proximally up to length becomes same as yellow line here. So it should be same yellow line and blue line, the length of should be same, and this is line B. Now line C is drawn from the hinge point. Hinge point is here in the lateral metaphyseal region of the distal femur, and this is drawn from the center of head of the femur to the hinge point, and then line D is drawn from the hinge point to the medial, that is the hinge point of medial close wedge osteotomy, and hinge point to the proximal end of the line B, right? The angle between line C and line D is our correction angle, and in this particular patient angle between line C and line D comes 14 degree. So this is how we have to plan that from distal femur we have to remove 14 degree of wedge. So this is the site from where we have to remove the wedge, and it should be after removing the wedge we have to close the wedge, and then we have to fix it with the plate and screws, whichever the method convenient to us. And after fixation we can see that our weight bearing axis is passing from the medial compartment where we have exactly planned, and this is the lateral view. And if we measure the lateral distal femoral angle after surgery, then it comes 88 again. It's very near to the normal. So this is how we can correct the distal femoral deformity by distal femoral osteotomy. And if we look towards the X-ray clinical picture, the valgus deformity is corrected well, and both the limbs looks equally now after surgery. And if we look towards the X-ray, the weight bearing axis, which was passing far away from the middle of the knee joint, now it passes from the medial compartment. So if you have any questions, if you have any doubts, please write down in the comment box. We will try to answer. Thank you for careful listening. Thank you.